In this lecture, we will talk about full metal crown. It's a full coverage crown made from metal. Full metal crown is one of the most commonly indicated crown restoration for the posterior teeth. Because it is made of metal, it should be used when the patient doesn't mind the appearance of metal or when aesthetic is not a factor. It can be used as a single unit or as a retainer for a fixed partial denture, especially when we have small abutment teeth with long span edentulous area, to withstand the occlusal forces preventing bridge displacement. Full metal crown has better retention resistance to displacement than partial crown restoration, because all the axial walls are included as well as the occlusal surface. The metal alloy types used in the construction of full metal crown included high noble alloys, gold alloy, low noble alloys, silver palladium and cold palladium, and non-noble alloys, nickel chromium and cobalt chromium. Indications of full metal crowns are: first, teeth with extensive destruction, such as extensive caries or trauma. Second, teeth with large amalgam restoration. And third, endodontically treated teeth. For all these points, we need to make a support for the tooth, so we cover it with a full metal crown. Fourth, when maximum retention and resistance needed, such in case when we have short crowns, so we use the full metal crown. 5. Recontouring of the tooth, such as a tooth receiving a clasp for removable partial denture. When the tooth is tilted or rotated, so we should recontour this tooth to receive a clasp for removable partial denture. 6. As a bridge retainer. 7. Correction of the minor inclination. 8. Patient with high caries index. When the patient with high caries index, we mainly use full metal crown. And finally, for the correction of the occlusal plane. The contraindication of full metal crown are: first, if high aesthetic need is demanded. Second, when less than maximum retention is necessary, so we can use a more conservative crown. For example, a partial crown or 3/4 crown can be used when we have a tooth with intact labial surface. Also, when we have a very short span bridge, we can use a more conservative type crown. Third, when caries index is low, the full metal crown isn't mandatory. The advantage of full metal crown: it gives us a greater retention and strength. Besides, the full metal crown has a higher resistance to deformation, and with the full metal crown we can modify the axial tooth contour. But the disadvantage of full metal crown: we need extensive tooth structure removal as compared to the partial crown, and difficulty to test the vitality of the tooth. Third, interference with the test. And finally, display of the metal. full metal crown preparation, according to the occlusal criteria, the occlusal reduction should follow the normal anatomical contour, as we call it a planar occlusal reduction, and the occlusal reduction should be 1 millimeter on non-functional cusp and 1.5 millimeter on functional cusp. And the axial criteria for full metal crown preparation the axial reduction should be parallel with the long X of the tooth, while allowing for the recommended 6-degree taper. As we mentioned in the lecture before, the axial wall should be parallel as possible, but it is difficult to obtain or maintain this parallelism, so we made it with a 6-degree taper, and we call it the convergence angle. And the finishing line that is used for full metal crown preparation, mainly we use a chamfer finishing line. A round end taper Fisher bear is used in the preparation to obtain the chamfer finishing line, which allow for approximately 0.5 millimeter of metal thickness at the margin. Before we do our preparation, we need a depth orientation groove. What I mean by depth orientation groove? The depth orientation groove is a groove that is placed on the surface of the tooth to act as a guide or reference to determine when sufficient amount of tooth structure is removed by the preparation. If the preparation is done without this groove, under or over preparation is possible, and more time will be wasted by repeated checking of the preparation. We start our preparation from the occlusal surface firstly, and this is called the occlusal reduction. We need 1.5 millimeter of clearance on the functional cusp and 1 millimeter of clearance on the non-functional cusp. And our reduction should be planar reduction, or we call it anatomical reduction. And this is done by putting a depth orientation groove on the occlusal surface with round end taper diamond, and the bear should follow the inclines of the cusp. And the depth orientation groove should be extend from the cusp tip to the central groove, which represents the deepest part of the occlusal surface. And the depth orientation groove is determined by the depth of the bear we used. That's to say, if a Fisher bear with 1.5 millimeter diameter is used to prepare the depth orientation groove, I obtained a depth orientation groove of 1.5 millimeter. And when a Fisher bear with 1 millimeter diameter is used, I take a 1 millimeter depth of the depth orientation groove on the non-functional cusp. After the depth orientation groove are put on the occlusal surface, any tooth structure between the depth orientation groove should be removed following the normal contour of the cusp. As you see in this picture, the depth orientation grooves are placed on the ridges and the primary grooves of the occlusal surface, and the burr should follow the inclination of the occlusal surface. And if there is already some clearance with the opposing tooth because of malposition, the groove shouldn't be made as deep. After I finish the occlusal reduction, I should do a functional cusp bubble, which is a wide bubble that is placed on the functional cusp. As you see in the first picture, the yellow color is the functional cusp bubble. And the functional cusp bubble is integral part of the occlusal reduction because failure to produce this bubble can produce a thin casting or a poor morphology. So we do a functional cusp bubble to follow the normal anatomy of the tooth structure. After that, we should check the occlusal clearance in centric and eccentric occlusal relations by the use of the probe or by using of the wax, as you see in these pictures. After we finish the occlusal surface preparation, now we prepare the buccal surface. We need a 3-depth orientation groove on the buccal surface with the same burr, and the depth orientation groove should be placed parallel to the long axis of the tooth or should be placed parallel to the path of insertion of the restoration. Then we should remove the tooth structure between the depth orientation groove by moving the burr medially and distally following the inclination of the surface. And we should maintain the burr parallel to the long axis of the tooth because the end of the burr, which is round end, will draw the finishing line, so we can obtain a chamfer finishing line. Then we prepare the lingual surface with the same procedure we followed in the preparation of the buccal surface, as you see in this picture. The burr should be parallel to the long axis of the tooth, and the end of the burr will draw the finishing line, which is a chamfer finishing line. We should do preparation to the proximal surface. We should use a very thin, long taper die bond burr to open the contact between the tooth. And we should use a very thin burr to prevent any damage to the adjacent tooth. The burr should be moved up and down to open the contact buccolingual. Once the contact is opened, I shift again to the first burr, which is a round end taper fissure burr, to plan the walls to form the chamfer finishing line. I can use a safe-sided disc, or I can use a matrix band to prevent damage for the adjacent teeth. Now I should do finishing, that's to say smoothing of all the axial walls and removing any sharp angle, because if I left a sharp angle, they act as a stress concentration area. Finally, I should place a seating groove. As you see in this picture, these are a seating groove and it should be placed in the buccal surface of the lower molar and on the palatal surface of the upper molar. The seating grooves will act as a guide during the placement of the crown. Besides, it prevents the rotation by increasing the resistance, and also it improves the retention. In this picture, I can summarize our lecture by first we do occlusal reduction, which should be a planar or anatomical reduction, as you see. After that, I should place a bevel, a wide bevel on the functional cusp to provide structural durability for the restoration. And then the axial reduction should be done by placing the bear, which is around end taper fissure bear, parallel to the long X, and the end of the bear will draw the finishing line, which is chamfer finishing line, because the end of the bear is a round end. After that, I should smooth our preparation and remove any sharp angle and place a seating groove on the buccal surface of the lower molar or palatal surface of the upper molar, which I mean on the side of the functional cusp. And the seating groove will improve the retention and resistance and act as guide during the placement of the crown.